A cybersecurity expert is calling the ransomware attack on University Medical Center Health System a national security threat. As we first reported yesterday, the cyber attack caused an IT outage within the health system and forced UMC to send incoming emergency and non-emergency patients to other hospitals.
The diversions continue this evening. KCBD News Channel 11's investigative reporter Shaylee Kidwell joins us now with new information about how this attack happened and how UMC is handling the outage. Shaylee?
Colonel Abner, UMC has updated its website with new information about this ransomware attack and how it will continue to operate until its systems are restored. Viewers tell us some of their surgeries and treatments are postponed as the investigation continues. We spoke with an expert about this who talked about who may be behind this attack as UMC navigates this healthcare crisis. The University Medical Center Health System is under attack.
This is a national security issue.
John Rigi is a national advisor for cybersecurity and risk at the American Hospital Association in Washington, D.C. Prior to joining the AHA, he spent nearly 30 years with the FBI.
Little did I realize that all that previous experience on counterintelligence, international organized crime, counterterrorism was all directly relevant to cyber because it was the same bad guys using cyber as their means to attack us.
UMC is the only level 1 trauma center within 400 miles. While the hospital continues to treat its current patients, incoming emergency and non-emergency patients must be diverted via ambulance to nearby health facilities.
When you have the only level 1 trauma center in the region shut down by foreign bad guys, and ambulances on diversion, the next level 1 trauma center, I understand, is hundreds of miles away. You're putting people's lives in jeopardy.
Who would do this?
Primarily, these ransomware attacks are perpetrated by Russian organized crime gangs. And quite frankly, they are provided safe harbor by the Russian government to conduct these attacks against the United States critical infrastructure and against Western nations. And we're also seeing the phenomenon now of where Russian ransomware gangs may be colluding with other nation-state actors, such as the Iranians.
Rigi says to successfully combat the rise in sophisticated ransomware attacks, healthcare systems are going to need assistance.
No individual hospital, as good as they are, can defend against these very sophisticated nation-state sponsored or supported attacks. We need the assistance of the federal government to do more on offense, to go after these bad guys like we did in counterterrorism.
So how does a ransomware attack actually work?
Once they initially penetrate the organization, the bad guys try to do one or two things pretty quickly. They try to steal patient health information, which they will subsequently hold that for ransom. They will try to locate and encrypt the backups and then encrypt networks and their infrastructure to shut down medical systems and information technology systems.
Is your organization aware of any other hospitals across the country that were also hit with some sort of ransomware or cyber attack?
We are not aware of any other hospital at this time that was targeted with a high-impact ransomware attack similar to UMC.
UMC says it doesn't have a timeline for the full restoration of services.
In general, it would not be uncommon for a victim of a high-impact ransomware attack to take up to 30 days for recovery of their systems. Again, putting patients in the communities in jeopardy as they're attempting to restore systems.
UMC says its healthcare facilities remain open, including emergency centers and urgent care and UMC physician clinics. However, certain departments and providers are on downtime procedures. UMC says if you have a specific question about your treatment or appointment, contact one of its care sites or your provider directly. The hospital says it is actively working to contact patients with further instructions. As we mentioned, UMC has updated its website with new information about what happened and how it's handling this ransomware attack. Here's how you access that information. We've pulled up the homepage of UMC. You'll see this banner. It says, for more information on the IT outage, click on Learn More. If you click here, you should see a list of frequently asked questions along with some answers. Included in this information, the hospital says it has called on third parties that have helped other hospitals address similar issues to assist in UMC's response and investigation. Again, a developing story that will continue to follow. Karen and Abner.
Thank you, Shaylee.